Good evening, everyone. My name is Dr. Jeff Goodhue, President of OAO, and first of all, I'd like to thank everyone for taking time out of their busy schedules to come onto the call tonight, but more importantly, I'd like to thank you for volunteering to host your local MPP in your practice on Optometry Day on Tuesday, November the 10th. So tonight's webinar is to give you all the tools, the tips, tactics on how to host the MPP in your office and make it as successful as possible. In the past, we've asked members to book time out of their schedule, go to their MPP's office, sit down for a face-to-face meeting, and the uptake on that strategy has been, I guess, lukewarm at best. So we've turned it on its head. We've thought, you know what, let's have the MPPs come to our offices, and I'm pleased to say we are going to probably hit twice to 2.5 times as MPP, or 2.5 times as many MPPs than we ever have in the past. So even though the day hasn't arrived, we know that we're going to be at least twice as successful as we have been before. So having the MPP come to your office allows him or her to experience firsthand what it is that we do on a day-to-day basis. Just like when you get that first-time patient in your practice, they often are not aware of our full scope and all the things that we do related to the delivery of comprehensive eye health and vision care. So that MPP, their knowledge of optometry may be quite extensive, or they may not have any idea what it is that we do. So it's our job to tell them. OAO has embarked on an ambitious advocacy strategy that we launched in April of this year with the release of our white paper. And just to remind everybody, the white paper is a deep dive into the delivery of primary eye care in the province and lays out a series of recommendations to optimize our role in the eye care space. So Optometry Day is a continuation of this strategy to help inform decision makers about what it is that we do and how we can help government get better value for the substantial dollars it's spending on eye health and vision care. At the end of the day, and I can speak from experience here, having met lots of politicians over the past few years, they're regular people just like you and I, and they only know things that people tell them. So this is our opportunity to get in front of them and tell optometry's story. If we don't do that, there's lots of other people out there that will. So before I hand it over to the organizing team that will lead you through the rest of the webinar, I would like to thank you, the members who've stepped up to the plate to host an MPP. Thank you on behalf of the entire profession for getting our message out to decision makers in this province. I'll start with introducing Carolyn Merchant. She's from Edelman, a Senior Account Manager, Corporate Communications. She leads work ranging from executive positioning to employee engagement to corporate reputation for a number of large clients. She's been working with OAO since December 2012 as the day-to-day lead, supporting all aspects of the association's work. Also from Edelman, we have Jeff Lang, an account manager on the corporate and digital teams at Edelman. He provides support to clients in a variety of industries and with experience in the development of digital strategy, engagement with online communities, and working with cross-practice teams to ensure that corporate communications, marketing, and public affairs goals are met effectively. His clients operate in a broad range of industries, including industry, associations, professional services, packaged food, and government. And then last but not least, we have Jason Greer. Jason is a founder of Santis Health, a Toronto-based public affairs and communication strategy company specializing in healthcare. Jason has served as Chief of Staff to Ontario's Minister of Health and Senior Health Policy Advisor to the then opposition leader Dalton McGuinty. While carrying out his role as Chief of Staff, Jason was also the Minister of Health's lead advisor on the government's most strategic and transformative health policy initiatives, many of which are alive and well today, such as LHINs, family health teams, and the wait times strategy. At the federal level, Jason served as an advisor to the Ministers of Health, Public Works, and Transportation, and he has been working with OAO for the past 4 years and was a key advisor in the development of our white paper. So Jason, I will hand it over to you and you can run through what you have laid out to help our members host a successful Optometry Day.
Thank you, Jeff, and I guess welcome to Ontario's first ever Optometry Day, November 10th, or for some thereabouts, but it's an exciting time. It's a new area of activity for the OAO. As Jeff had mentioned, the Ontario Association of Optometrists has been engaged in policy development and advocacy to expand the opportunities for you to play a role on behalf of your patients, to improve your practice experience and ultimately ensure better compensation for members of the profession. Government plays a critical role in shaping these outcomes. So it's important that we engage government. We ensure that they understand the role that you do play and the opportunities for an expanded role for optometrists. MPPs are an important part of the government structure. So engaging members of the legislature who have influence over government policy and can raise key questions in the legislature and can be your supporters is worth doing. So I'd say congratulations to all of you for stepping up and agreeing to do this, because it's important and it does have value. Optometry Day is the newest component, as Jeff had mentioned, in the OAO's advocacy strategy. And already we've gotten a great response from MPPs and from the optometry community. It complements some of the other things that we've been doing with the OAO, including Queen's Park Day earlier this year, the launch of the white paper, and ongoing day-to-day government relations activities by the association. Optometry Day really brings value by helping optometrists in their communities build relationships with their MPP. So, when you look at this meeting, it's not a one-off or even it's just a first step in building relationships. So when you think down the road about this meeting, also be thinking about your future engagement with those members, that you want to build that relationship. You want them to see you as a trusted advisor when it comes to matters of the eye. It allows you an opportunity to really communicate your value to patients in the community and to build support for a greater role for optometry as Ontarians' primary eye care providers. And it's interesting because you're going to be doing this now in your office. And I think that represents, we're going to get into this in a little bit more detail, but it represents a unique opportunity to tell our story in new and different ways that are creative and ways that are really going to be memorable for the MPP. Though, in a sense, it'll leave a permanent impression on them. This really should be about improving understanding of your role, helping those members really understand what it is you do and what you could do for patients in the future. Again, we're always thinking in terms of the public interest. What does this mean for patients? What does this mean for the health system overall? What does this mean for government? And less about what it means for you. Although ultimately, this is going to help drive a better experience for you by really emphasizing your value. But the communications here in an event like Optometry Day really needs to be thought of from the perspective of trying to speak to your audience in a way that's going to resonate with them about things they care about. Also, by engaging in additional communications activity, which we'll get into a little later in the presentation, including things that you can do, including the use of social media, you're able to help elevate the profile of optometry across the province on this particular day. So we're going to be creating a real buzz out of these events. So a lot of these events are happening across the province in individual ridings, but collectively they're going to create a real buzz that's going to resonate back at Queen's Park and with our government. So ultimately what we're trying to do in an event like this is really tell a story. I mean, if you want to keep it simple, that's what we're trying to do. We want to tell a story, and stories are very powerful in getting people to take action in the policy sphere. So think about this day as a chance, using creative and different ways to tell stories that convey your value, with a particular emphasis on things like urgent care, children's vision, seniors' vision, and managing the various eye diseases in order to minimize vision loss, and the need to engage other parts of the healthcare system. Our story is ultimately about increased investment in optometry care in order to improve access for patients and drive better health outcomes, yet within the larger fiscal framework of the significant investments already being made in eye care. So it's optimizing the investments that are being made. So when structuring your Optometry Day session, think about the various ways you can tell these stories and these components of these stories. This is really more than just a meeting. Think about the way that the MPP coming to your office really adds value versus going to their office or meeting at a coffee shop. Think about how you can integrate other people who might be at your practice, other people you might have invited to the session, and your equipment as a kind of prop or props to help really illustrate your story. And look to move people through your practice if you can. Look to create a dynamic environment as you tell the story. We're going to go next to some of the key components of the story. And what I'm going to go through here are really sort of the top line messages. And sometimes people will refer to something like as an elevator speech, which means you got 30 seconds with somebody in an elevator. What can you tell them in terms of a complete story in the time it takes to get from to the 8th floor to the ground floor? It represents a frame to have a conversation. It is not. This is not the script that you would use. I want you to think about this and internalize this as the core story we're trying to tell. In the packages that you will have received, there is some additional key messages and additional background. And that'll allow you to put some flesh on the bone. But you also have experience in your day-to-day practice to call on. So stories that you can tell about real patient experiences that help bring these key messages to life in this core story. So this core story is really about explaining that you're well equipped to work with other healthcare professionals and other parts of the healthcare system as Ontarians' primary eye care provider. The go-to people when patients have an issue with the eye, the gateway into the broader eye care and healthcare systems when it comes to vision. That you're well equipped to do that, but you're also well equipped to step into a bigger role in eye care, given the proper support and investment by the government. We also want to emphasize there's a need for change, that the way things are done today isn't good enough. There are growing challenges in the system, and they need to be addressed. Those challenges relate to gaps in care, an aging population, and the fiscal constraints that are being imposed. So we're already working miracles. You're already working miracles, of course, in your office, but you are able to do much more. And I think that's a key point to have MPPs take home with them, that you're ready, willing, and able to do more, but you need to have proper support to do that. And this will mean something important for Ontarians. It'll mean better access, it'll mean better health outcomes, and it'll mean better value for money for the healthcare system. So while this isn't the focus of the optometry discussion, it's important also to touch on the fact that we have launched a white paper, and that provides a bit of a roadmap. And there's more information that will be in the package, and all MPPs actually have received a copy of the white paper. So this isn't not really an occasion in which you will go through all of the white paper, but I think it's important to touch upon that there is this roadmap. It's pretty hefty. It's got it lands with a thud on your desk, and it is a lot of thought and research has gone into the development of those recommendations. We've talked about the story. We've talked about the core messages, and when you look at your optometry day session, as I mentioned earlier, you need to structure it in a way that's it's more than a meeting. It's not a one-on-one session. You have, think about the opportunity to take that hour that you might have, or if they're giving you more than an hour, that's great. If they're giving you less, making the most of it. Really looking to do something that is more hands-on, that's more engaging, that kind of breaks up the hour into different components, thinking always about the story you're looking to drive. So this here is an example of how one might structure your day. I don't want you to look at this as being prescriptive to you in a sense that this is how everybody's day ought to be structured. I think it would be great and really fun for you to look at how different ways that you might approach this. So in this case, we've looked at the MPP comes in, there's a bit of arrival and a meet and greet, and hopefully you might take some pictures, etc. You may have some other colleagues present, so hopefully that you may have reached out to other optometrist colleagues, other people who may work in your practice. You might have, there might be a family doctor who you have a good referral relationship to and who's very supportive, who might be there as well. And you might choose to get some patients to come and participate. So however you view the other participants, you then want to use that as an opportunity to tell some of those stories, again, about the 4 key themes we mentioned. So find an example or a story about how TPA prescribing, for instance, has helped benefit a patient. And if you've got a patient, you can maybe talk about that experience, about how they, it saved them a trip to the doctor's office, and it's been much more convenient to have the optometrist be managing their eye care than having multiple providers. So having a discussion about looking for some way to really illustrate the value of children's eye exams as they go into school, for example, and what we've been doing with ICI Learn, for instance. Take them on a tour of your office, and think about that tour of the office as including a number of stations that you can bring them to, demonstrating key pieces of equipment and talking about how that equipment relates back to the opportunity you have to address a patient's urgent care problem, for example, or help over the long term manage a patient with diabetes and make sure that we're keeping a good eye out for the dangers of diabetic retinopathy. So think about how that technology can help tell a story as you take the MP3 through that experience. And the idea of having a bit of a reception makes this the more people, the merrier, in the sense that MPPs will have found, all right, so I've gone to this meeting and I've had an opportunity to touch more, as crash as it sounds, members of my community and voters. So in some cases, you might invite your staff, some of your patients, some of the community leaders to do a photo reception at the end of it. So that's an example of how you might structure it, but you may have some other ideas in terms of being able to really illustrate and drive that story. But think about examples that you have in your practice of things that are happening or things that have happened in your practice, and think about the other opportunities if you're able to do more and what that might mean. So opportunities or occasions in which you've been able to help patients, and occasions in which you've been frustrated because you were not able to help patients because the supports aren't there yet.
The goal of the day is really to make it as memorable as possible. So wherever you can have things be more interactive as you're showing different technologies, where appropriate, if they can try some of it or look through some of the different equipment that you have, making it really personable, allowing them to kind of touch and feel and get a true sense, day in the life type experience while they're in your office. And then again, to Jason's point, the patient stories are really what brings it to life, and they are, very interested in understanding what is important to the members of their community. So bringing that to life. So as we get ready for Optometry Day, we just want to highlight a couple of key things. Everything that you've already received, we just want to walk through at a very high level some of those materials. First off, and this is our biggest priority right now, is confirming your MPP's visit. So we're very happy that you've all signed up to participate, and now it's really about making sure your MPP can visit. Many of you have probably already reached out. Some of you may have already confirmed them. If you have not yet heard back to your initial email or calls, now is the time to start following up fairly aggressively. We would recommend, once every 2 or so days, just giving a call into their office, following up politely, obviously, but we want to make sure that they are available to come. A couple things to highlight, and Jason touched on this. If they are only available for a short window, please take it. Even if it's a short period of time, any time is better. And if a different day during the week of November 9th works best for them, please be flexible. We have November 10th as Optometry Day, but it's not really tied to that day in any of the materials or public-facing communications. So be flexible as possible to accommodate their schedules, because they are quite busy when they're in their hometown. So jumping to the next slide, just wanted to touch very quickly on the toolkit contents. And just encourage you to take a very good look through each of these. So in your toolkit, which you'll have received by the mail, includes a Ontario Legislature background. So that is really just to give you a high-level understanding of how the legislature works. So that as you're having conversations with your MPP, you have insight into their world as well. The instructions on inviting your MPP, hosting guidelines. So in that, we've now walked through a bit of what the day can look like. But again, please make that day structured so that it fits both the time that you have and the flow through your office. The key messages are in here as well. So as Jason said, please take time to really internalize this. This is going to be your story guide for your meeting with your MPP, and they can come into play at all throughout your conversation. So it's really not a one-time talking track. It's really points that you can make as you're showing different pieces of technology or talking about different patient stories. It's really there to help you and support your conversations and provide any data points. And then finally, we have a questions and answers document for you as well. So if you have any of the tougher questions or even some very simple questions, it's just there to help you answer those questions. So just a helpful thing to look through, but please do take advantage of these resources as you get you and your team ready for Optometry Day. So now we're going to get into some of the logistics of the actual hosting. We wanted to talk through some of the do's and don'ts. So this is also in your Optometry Day toolkit. The first thing is to be prepared, and by being prepared, we mean look into your MPP, find out what their hot button issues are and what their focus is in the government. Just so that you're familiar and you can have some sort of lighter conversation as well. Be efficient. So your MPP may not have a lot of time, but they may have a lot of time. Still, using that time as to the best of your ability will really help shape their experience at your office. So again, making it memorable is really important. So part of that is making sure you're showing the right things at the right times and not taking up too much of their time. Show and tell. So we've touched on this quite a bit already. Anywhere that you can actually show something, give a bit of a hands-on experience, the better, so that they are able to internalize what your day-to-day life is like. Provide a patient story. I think we've really covered that off, but anecdotes are so important, and just on that point as well, anecdotes, even if they are not directly related to a patient, they might be related to your experience with a family physician or an ophthalmologist in your neighborhood or community. Talking about how you work with them is really important as well. So anywhere that you can cover off your spectrum of care, the better. And follow up. So we'll be providing you with a template that you can send your MPP following the meeting. As Jason said, this is the first of many touch points. And so having that follow-up note kind of closes puts a bow on Optometry Day, but then also opens the door to future communications as well. And then for our don'ts here, don't assume. So these are people as well. They aren't experts in optometry. They may or may not have varying levels of understanding. So the more that you can provide background and context, the better. And that leads us nicely into the next point. Avoid using jargon. Speak to them as you would to any of your patients. So providing good explanations of things, not using the medical jargon that you would use with colleagues, making sure that it's really something that they can understand and incorporate. And then pressure or argue. So while we do want to share information about optometry and how optometry can do more in the province, be positive about that story. It's really important that this is the start of a relationship. So the more that we can be helpful and provide the right information without being negative or demanding, the better relationship you'll be developing. So you have also received collateral, which will be of good use for you on Optometry Day. We've included a few examples of what's been sent to you. So each of you will have 10 postcards of each of the four variety. These are all actual key points from the white paper. So these will help you talk and touch on the white paper without having to go into too much detail, but they do highlight some of the bigger gaps in eye care in Ontario. The tent cards that you've received just provide some really basic information about the services that optometrists provide. And then you'll also have received a number of posters as well, which can be placed around your office. Anywhere that you can put these where they fit, the better. We recommend that you spread them around so that as people are taking the tour through your office, they're receiving that optometry touch point in each room. The postcards can be handed out, so you can give your MPP a few of each so that they can hand them out or leave them with some of their staff members. But please use them, even if there's other community members that have attended and are interested in learning more, that's a good opportunity to give them more information as well. And then on the personalized poster that's been shared with you, which you can see on the left-hand side of the screen, we encourage you to put that either on your door or in your welcome area so that as the MPP arrives, they initially feel welcomed.
So the first thing that we want to talk about from my perspective is the social media aspect of Optometry Day. You'll all be receiving in the next little while a social media toolkit that's providing a couple of things. The first is a little bit of sort of directional content and posting tips on the ways that you can reach out during Optometry Day to the audiences that you've established on social channels, for those of you who are active on, say, Twitter or Facebook. So I'll just run through a few of those tips here so that we have gone over them on the phone. Once again, you'll be receiving a document that goes over these as well as a number of other tips for engaging on Optometry Day. The first is that we really want you to tailor messages and what you're putting out through your social channels to your audiences so that they fit with the voice of other things that you posted in the past. Some of you will be much more active on Facebook or Twitter. Others will use them more sporadically, and I'm sure some of you aren't active on social channels. There's no need to start a channel or begin to engage in a way that you otherwise wouldn't, but if you are on a channel and maybe posting less consistently, feel free to use the templated content that we've given you sort of verbatim. And for those of you who are sort of more comfortable with their voice, who post more regularly on social, please, again, we encourage you to adapt as you see fit in order to best connect with your audiences, who I'm sure you know well. When you're posting, make sure that where possible, tag your MPP and the Ontario Association of Optometrists Twitter handle in your tweet. So the Ontario Association handle is @OnOptometrist, and your MPP's Twitter handle should be easily accessible through their website if they have one. Again, that just makes it a little bit easier for everybody to see. The OAO handle will be looking to share a few tweets throughout the day from the optometrists that are participating. So tagging that handle will allow us to find that a little bit easier. And again, your MPP may want to share news that he or she is out engaging with constituents. So again, tagging them provides an opportunity for them to engage with you back or share that content with their followers. The other piece is to proofread all content carefully before publishing. It sounds really basic, but a lot of you are going to be really busy on Optometry Day, and many of you will be tweeting or posting from a mobile phone. It's really easy to make typos, and again, we're trying to build a relationship with a new stakeholder, show them what optometrists can do, and it can be a little bit of a road bump to have content that is not carefully proofed. The other piece that I want to flag is that content with images can be a really great way to show what we're doing on Optometry Day. The purpose of this day is really to provide an inside look of your office to MPPs. Once again, including images will be a great way to allow them to extend that inside look to their followers if they choose to reshare your content, as well as to show your patients and other followers exactly what it is that you're doing in terms of interacting with your MPP. They'll be able to see parts of your office that they recognize, the equipment that they've experienced during their visit, and again, we'll just help bring that the tour closer to home and let them get a better sense of what's going on. Your MPP is a public figure, will know that he's at your office and that sort of some social posts may be going on. But with other guests, if you're taking photos of them, or even if they sort of happen to be in the background while the MPP is looking at something, please be sure to get their permission before posting their photo, just to ensure that you're maintaining the best relationship you can with the other folks that you've invited to your Optometry Day event. And then finally, kind of as mentioned, where you can show off your office and the kinds of services you provide by sharing photos, including equipment or patient interactions. Again, where you've obtained permission from that patient to post a photo, that's great. It helps to personalize things and helps to steer away from a more generic message to give an inside look at your own practice. The other piece that we want to go over quickly is media relations. Earning media coverage in newspapers, etc., is not sort of the prime purpose of Optometry Day, but where possible, we're going to take a look at opportunities to tell the story about the MPP visit, as well as the services that optometrists provide in the community, to local papers. So this will be probably much more effective in areas that are a little less media-centric. Community newspapers are probably going to be the target that is interested in these kinds of stories. OAO is developing a news release that will be customized to outline individual meetings with MPPs. It will be sent to local media the day following an Optometry Day event. We'll share that release draft with all of the optometrists for whom we are planning local media outreach beforehand, so that you know what's in it, are comfortable with the messaging that's going out, all of that kind of stuff. We're also going to work with, where possible, with MPP staff in order to secure quotes from them outlining why they've attended Optometry Day and sort of their excitement of being able to learn more about the practice of optometry in Ontario. One of the things that we'll flag for you is that where we think we'll find some success with this in community papers is where we're able to share photographs of the event. Really the draw here is the attendance of an MPP at a local constituent business, learning more about the practice, learning more about the patient. So wherever we can have photos from you guys, sharing photos of the MPP in the office, interacting with patients, again, where we have permission to share those photos of patients, that'll really help us to secure some interest on that front. So we'll be in touch as the day approaches with reminders about that, and you'll be seeing the draft release in advance, but wanted to flag all of that in, while we're here. Then finally, we wanted to make sure that as you're wrapping up discussions with your MPP, you're providing them with some of the takeaway materials that have been provided to you. You'll have copies of the white paper as well as the postcards, the 4 postcards. If you can prepare a little kit to include for them, including those pieces, so that they can have those materials to take away with them. Finally, if you have any questions that you can't, if they have any questions for you that you can't answer, let them know that you'll follow up. No need to sort of rush yourself to find an answer immediately. We can work with you in order to help answer any questions that the MPPs have. As well, we'll provide a follow-up note, which you can use to build opportunities for furthering relationships with your MPP, thanking them for coming and establishing yourself as a contact for future questions they may have about eye health.
So thanks, everybody. Thanks to Jason from Santis, Carolyn, and Jeff Lang from Edelman. So good luck on November the 10th. Before I look at the questions here, a couple things I'd like to bring up. Try to invite your colleagues, like if you guys are the ones hosting, invite your colleagues in and around your practice to join you. You know, you're going to get some great promotion, obviously, when the MPP comes through your practice. But this is really about promoting the profession of optometry. So, you know, your colleagues in your surrounding practice area, if you can maybe just shoot them a quick email, let them know what you're doing, that you're hosting, and that they're welcome to join you if they would like. On the social media side, as far as posting and things like that go, maybe have a staff member ahead of time take the pictures so that you can concentrate on delivering the message and giving the tour of your practice, and you don't have to worry about posting on Instagram and Twitter and coming up with content. Let your staff take the pictures, and then when the MPP leaves, you can pause, take a deep breath, and do your social media tweets and posts. So as far as questions go.
So for the first question, we see no issue with that as long as you are following the same rules for photos. So your MPP is a public figure, so you can use the short video clips, but anyone else that's in the video would have to have a photo release or video release form signed, or at least consent given to be in the video.
A good place to go first is their website, and in particular zero in on their bio, and that will give you a little bit of background. Their bios are usually included in their website. If they haven't included it specifically on their website, doing a search for your MPP's name and bio will pop that up. And usually you'll get a sense in terms of not just of their career, but some of their key interests. And perusing their website will give you some sense as to what their interests are, what their priorities are, what kind of things they're pushing in the legislature. This really can vary depending on the size of your community, similar to what was referenced with respect to media relations. So in a smaller town, you could invite some of the local municipal politicians, but I think even more importantly, people like the president of a local board of trade or chamber of commerce, some of the local business leaders. Here's the way really to look at it. The MPP is who would the MPP be happy to sort of see there? Who are people in their communities? How does this represent another opportunity for them potentially to touch others? I would think looking through the prism, particularly of healthcare, is certainly going to be helpful from this perspective. We're not necessarily suggesting a cast of thousands, and some of you may choose to have a reception, some of you may not. But if you're looking to have create a little bit of a buzz and a bit of an event, then reaching out to some of the folks that you know in your community who might be able to stand there and ultimately support your message would be worth doing. If you are inviting local councillors, that sort of thing, that's probably a good idea to give that the MPP's office a heads up about who to expect and that sort of thing.
Just on one more point on that one, you can also feel free to invite local media to your event, whether that be a local print journalist or online journalist. Having them there and experiencing the day alongside you and the MPP always helps build a richer story. If you are interested in reaching out to your local media, please let us know and we can help you with any tips. If you have questions about how to do that, we're happy to provide more details.
Yes, but I think you should be thinking this is a positive event, and you should be looking to position issues like remuneration in the context of our goal of improving access to quality eye care and improving the efficiency of the system. So the remuneration issues need to be kind of flipped around to ones of positioned as barriers to achieving the kind of results we want. And so I think you do want people to remember that optometrists haven't had an increase in a very long time, and other professions, frankly, have, and that our fees in many instances are indeed the lowest in the country. It's important for them to know that. But think about trying to present this as from the perspective of the public interest and why the public should care. It's not about fairness. It's not about, it's really not right that we haven't had an increase, even though all of that's true. What's really important here from the MPP's perspective is to understand how is that affecting Ontarians. You want to see this is actually making it harder for people to access care and making it harder for us to do our job. And so remuneration ought to be addressed from the perspective of improving access to quality eye services.
So I think the way to answer that one would be, it was the Liberal government that gave us expanded scope in April 2011, so you can thank them for doing that. The problem is that they didn't modernize the fee code along with our expanded scope. So I would frame it in a context like these patients, yes, that's a barrier, and what happens when they hit that barrier? Some of them do actually pay privately in our practice, but oftentimes they'll embark on a very expensive journey through the healthcare system. They'll go to the walk-in clinic A, walk-in clinic B, family doctor, referral to ophthalmologist. Those journeys have significant dollar amounts attached to them.
Yeah.
So there are really good ways that OAO is now working with government. We're trying to show them what that cost to that journey is for that patient as they move through, and how much better it would be if we were remunerated fairly to see that patient first.
And the other thing, just on the nature of that question as well, if you get questions, any questions that you receive about your practice, you're the expert. So answering it honestly is going to be really important. Wherever, like Jason said, wherever you can show the impact on Ontarians or the value to Ontarians, that's the best way to frame your answers. But certainly, share your expertise and be honest and open with your MPP so that they're seeing, so that you're transparent and they're seeing the value of the care that you provide. The next question is, there's no harm to post following Optometry Day. If you can post even one message the day of, even if it's before they arrive, can't wait to host my MPP today, then that's a good way to approach it, understanding that you probably are quite busy before and after your MPP visits. There's no problem in posting the next day or 2 days after, but the closer to is always best.
I guess in some ways you can look at that answer as both.
Yes.
If you can do something on Optometry Day, something leading up to Optometry Day, if you have the time, and something in follow-up, that helps. I mean, as many touch points as possible. So with respect to the number of patients you should invite, I think you were looking at, given the time constraints, 1 or 2 patients. It's not a cast of thousands, again, coming into the office. But think about how you really need to look at this from the perspective of how you're framing out your particular session, if you've got an hour or an hour and a half, and how you want to move things. You may have a few, and how many great patients you might have who are going to be willing to engage. So, for example, you may have 3 different stops along the tour of your office, and maybe it makes sense to have 3 patients, one at each of those stops. It really will vary. There's no perfect answer for that.
And it would be good to think as well about the story that they're telling. So highlighting different elements of those 4 key pillars. If one patient has a really strong urgent care story and another has a great disease management story, highlighting different aspects is helpful so that your MPP can see the real life version of the facts that they're receiving.
Now, we had a comment here from actually Dr. Ahmed, who has piloted Optometry Day with a real live optometrist, and she made an important observation, and a key point, purpose in actually having a dry run was to identify these things. She had invited 5 patients and said that that she took them into the exam room to go over their stories, but the MPP kind of got bored after 3. So it may have started taking too long, and she found that 3 ended up being an excellent number, and I think that that makes sense. 2 to 3 keeps them engaged, keeps the variety there, but doesn't start to kind of get repetitive and drag on. So thank you for that.
The next question around glaucoma management, and obviously optometry has to charge for OCTs privately. A lot of the glaucoma care that our members deliver is private pay. So how do we address that? And I think what we need to say is that the government should be paying to treat the condition irregardless of the provider. So if a primary open-angle glaucoma patient is treated in Ontario, the remuneration should be the same or very similar for the 2 groups that are able to treat that, namely ophthalmology and optometry. So I think you need to focus on the glaucoma patient needs to be, covered. If they're covered by one provider, they should be covered by the other, and the remuneration for the diseases we're allowed to treat within our scope should be very, very similar.
Right, and I think it's important when talking about that to really emphasize, again, the behavior you're trying to incent, and the idea that otherwise it's a barrier. So again, it's not right that they get paid and we don't. It's actually, what does this mean for patients? What does it mean for trying to transform healthcare and have it be delivered in a better, more efficient way? It represents an important barrier, and it needs to be addressed. Is there an easy way? It is easy once you know how to navigate sort of the Hansard site. But if you go to the Ontario Legislative website, so you could search Ontario Legislature, you can do a search of bills. It's not usually by the MPP, but you'll see the table should actually list all of the sponsors of the various bills. So you'll have government bills that'll be sponsored by a minister, and then you have some private members' bills, which will deal with important issues of public policy. And often they communicate a sense of, that they might only get one kick at the can at a private member's bill. So it can communicate a sense of, oh, they're really interested in this issue. And in the case of John Fraser, for instance, he had pushed children's vision screening in the past, and that would have been identified. You may have to search by various parliament or various sessions of the legislature, because currently they'll have this session's bills listed. And as you go to that website and try to navigate it, you'll be able to go back in time and also look and see what bills went through the legislature.
The next question is about whether or not you can get additional copies of the white paper if some of your community leaders or attendees are interested. The answer is yes, you can receive more copies of the white paper. Just please let us know. A reminder as well that you can visit ontariooptometry.ca, and the white paper is available for download in PDF form on that website. It also has a video outlining the high-level structure of the white paper and an infographic that breaks down some of the data as well. So that's a great resource if people are interested in learning more. The next question is about receiving digital images of the postcards. Yes, we can send those around, and we can do that in very short order, so we'll make sure that all of you have that.
I think that wraps it up for questions, Jason and Carolyn. I don't see any more. Very good questions, actually. I hope you have a successful day. And like I said, you're doing this on home turf. This is your practice. Talk like you would to your patients every day. Try to stay on the positive side of the message, and let them know what optometry does.